everybody. Welcome back to another episode of Honestly Bilal. I'm your host, Bilal Ahmed, and this is Honestly Bilal, the show for the aspiring ophthalmologist, where I sit down and talk with medical students who are interested in ophthalmology, with residents who are training in ophthalmology, and with current ophthalmologists in the field today. Today, I'm joined by my guest, Dr. Alice Lorch. Dr. Lorch is the program director for the Ophthalmology Residency Training Program at Harvard Medical School, and she's an assistant professor of ophthalmology at Harvard Medical School. Dr. Lorch also is the Associate Chief of Quality for the Department of Ophthalmology at the Massachusetts Eye and Ear Infirmary. Dr. Lorch, thank you so much for joining me.
Thank you for having me. I'm excited to do this.
All right. So, I like to ask all my guests their origin story, what brought them into ophthalmology. So what piqued your interest in the field and got you on this journey?
So I think it was a little bit of serendipity. I was not one of those people who my whole life was sort of geared towards this. I kind of the person who likes a little bit of everything. I've always liked everything. And I was actually planning on going into internal medicine, and was a third year medical student. And I did a rotation in ophthalmology because I figured that internists should know a little bit about the eyes. And I rotated on our med student rotation with Roberto Pineda and Catherine Colby, who are these very accomplished and sort of well-known cornea surgeons. And the first case that I scrubbed in with was with Dr. Colby. I saw a pediatric keratoprosthesis. And I saw a kid who, I think at an etiology of a burn, sort of, have the opportunity, I think it was an 18-month-old, to regain sight, and thought, wow, what have I been missing? And this is incredible. And look what these people are doing. And this is something I want to be doing. I soon found that not every single case I scrubbed into, and not every single case I saw in the clinic was like a pediatric keratoprosthesis in terms of the sort of wow factor.
Mm-hmm.
But even so, I found that there were all the things that I liked about internal medicine in ophthalmology: the variety, the longitudinal relationships with patients, the ability to intervene and to do procedures, and all those things that I had liked in medicine. I could find them as well in ophthalmology. But also like the idea of being a really specialist, being an expert in something. And so that was sort of what I had above and beyond. And then after that, I got lucky. I got to know a bunch of the faculty at Mass Eye and Ear. They were excellent mentors for me. They sort of showed me about all the opportunities there were. I like to say that I applied that year, and I'd like to say that I wasn't the typical applicant. So, people always ask me, what do I need to have to be able to get into residency? And, I hadn't done any research in ophthalmology. I'd done one ophthalmology rotation, then decided I wanted to do it. And felt very lucky to match it at Mass Eye and Ear. But I try, when I look at applicants now, to think about that and think that, we're not looking for one kind of person, or one particular CV, or one particular background, that we're looking for variety. And I sort of tell that to applicants to reassure them, because I was certainly one of those people who decided very last minute and wasn't prepared with the sort of compendium of research the way that some people ask about. And I think the same sort of luck and serendipity followed me. So I did my residency at Mass Eye and Ear, and I have been there since, and I'm certainly biased in saying that I love the place.
Mm-hmm.
And it's given me a lot of opportunities sort of after that. So I just got interested in quality and outcomes research while I was a resident, and then I did my MPH at the public health school here after residency, and now do a lot of work in the quality and outcomes for our department. And then similarly, I stayed for a chief resident year after my residency, which is one of the sort of highlights, I think, about our program. And that year really fell in love with education. So I found myself teaching both in the OR and in lectures and clinically, and sort of loved thinking about education, the things that we were doing well, but the things that needed to be changed. And sort of was lucky for my path to then lead, now 5 years out, to being the program director. And so I feel like I have this little bit of sort of in-between inside knowledge, having gone through the program and not being that far out, that I know what our strengths and what our weaknesses are. And I know the things that I would have wanted when I was a resident. And I try to think about those things all the time as a program director. So yeah, that's sort of the story.
Awesome. Yeah. And I think that's one very unique thing about, being well, actually, you were also a medical student at Harvard as well. So your whole journey from medical school to residency for MPH year, like you mentioned, and as, for your chief resident year, those perspectives, I'm sure, really have shaped how you, as a program director now, must view the program. So, in that journey along the way from being at that starting point where you were first interested in ophthalmology, starting out at Harvard as a medical student, to now being the program director, I'm sure you've seen a lot of change over the years. So what are some things that you really take pride in about the program, or your things that you're excited about that applicants should know about the program? And what are some things that you're excited that are coming down the pipeline as well?
Yeah. So the thing that is still the best about our program, and was the best, I think, when I was a resident and before, is sort of the strengths of the residents that we have, and the faculty that we have, and the fellows that we have. I love the people that I work around, and I'm constantly inspired by them, both on the residents and the senior faculty. They're smart, they're creative, they're excited, they're engaged, they're collegial. They have a community, and I think that is what has kept me for so many years at Mass Pioneer, and that's what I continue to love about it, and that is our biggest strength by far, and something that I hope, despite the weirdness of this year with virtual interviews, we'll be able to convey to people. There are a couple structural things that I think are really special about Mass Pioneer. So one I already mentioned is the chief resident year. So we have a resident who is selected to stay for an extra year as a junior faculty member. And they are the director of the ocular trauma service, which means they do all of the open globe surgeries that come through. We get about 100 plus or minus a year. They teach in the OR. They teach the seniors on the globe cases. They teach the juniors on pterygia. They introduce a lot of our residents to cataract cases. They teach lectures every day to our junior residents, and time that's set aside for them to sort of go across the BCS series and understand the fundamentals of ophthalmology. And then really above and beyond that, they're a mentor and an advocate, and someone who is there purposely for the sort of the needs of their residents. So the administrative needs, whether that's family emergencies that come up, whether it's sort of personal advice that they need, whether it's career advice, whether it's linking them to the right faculty members, that's what the chief resident's for. The chief residents I've worked with have all been a rock for me, and they're people that I really rely on to let me know what's going on and what needs to be changed, and we work very closely together. And I just think that is a huge asset of the program. The sort of breadth of clinical exposure we have, I think, is another asset. So I never talk about our program without talking about our emergency room. We have one of the three 24/7 ophthalmic emergency rooms in the country. And it's where the juniors really become ophthalmologists. So we bring them into the beginning, and people are just sort of amazed about the breadth of pathology that comes through. There are people that get off planes from other countries to get a second opinion in our emergency room, and the first people who see them and work them up are our junior residents. And you will move from seeing some sort of tumor pathology to a neurop case to a open globe to a cornea pathology, all within a half an hour in the emergency room. The pathology is just immense. We've done a lot over the last couple of years to build up the supports down there. So we now have a dedicated teaching faculty. We've started a program called the Ophthalmic Hospitalist Service. So we actually have teaching hospitalists the way that you would on a medicine service, but they're ophthalmologists. And they're dedicated in the emergency room and on consults to supervising and teaching our residents. So that has made this place that has an incredible amount of pathology also a great teaching place, and a place where people are supported and sort of developing independence and autonomy, but also supported in that. So I think the clinical breadth, what you get in the emergency room, then beyond that, we have a bunch of different clinical sites. So you'll rotate at the Mass General and the Brigham, which are these huge academic hospitals. You'll rotate at the VAs. So we have two VAs. We have one in Boston and one in rural Maine. So you get a little bit of a feel of what's different about a VA, and also community and rural medicine. We rotate at Boston Children's Hospital, one of the sort of top children's hospitals, and that's where you do pediatric ophthalmology. And we have a global ophthalmology rotation in Erevan, and a lot of our senior residents decide to go to Erevan and then rotate there. So I think the clinical breadth is also something that we're proud of, and is sort of unparalleled. So those are the things I'm proud of. I'd say things that are sort of up and coming that I'm excited about. So a lot of the cool up and coming things come from our residents. So the way that I try to sort of lead the program is through resident feedback and making sure that the things that they want are heard, and we're sort of putting resources into those things and letting them to a certain extent lead the direction of things. So things that they have come up with in the last couple of years that I think are hugely important and successful are our wellness committee. So we now have a resident wellness committee that has had sort of a variety of different projects. So they have ranged from redesigning our resident lounge, so giving it a facelift, and I think they had fun with that, with picking out the wall colors and the couch colors, but also making it a place of community, a place where people could get together and sort of both for academic purposes meet, but also social purposes. They've organized social gatherings. But beyond that, they've started actually support groups with a psychologist. So we have a psychologist that is dedicated to our program who works with our eye trauma patients, but also now does monthly support groups with our residents working on mindfulness and meditation, sort of other techniques that residents need during a stressful time to help people with wellness. So that's something that's super cool that they've come up with. We have residents now who have recently started a diversity and inclusion committee, recognizing the need for sort of looking at diversity within a field of ophthalmology, and that it's a problem within the field of ophthalmology, and there's a lot that we can be doing. So we've been reaching out, we've been working on sort of mentorship of medical students and sort of increasing the applicants that we have of underrepresented minority medicine applicants, and sort of helping mentor people. And that's something we've been really interested in as well. Can't take credit for those all come from the residents.
Well, that's awesome. Yeah, and I know there's so much information also on the website that really speaks to all these initiatives, especially with the wellness program. What I really noted when I was on the website, that it's a separate, it's its own separate tab. So I think that speaks to how much of a priority it is for the program itself. And I know, a lot of us medical students who have been, applying for this cycle, or who have been going through this strange summer and spring with the array rotations. You were part of the presenters at the for the AAO webinar this past summer, and you mentioned the virtual surgical curriculum as well. So, and I know that was started by some residents too. Do you want to touch on that?
Yeah, I'd love to. So we are very lucky to have a state-of-the-art wet lab. And so we had a gift from a grateful patient a couple of years ago that allowed us to completely revamp our wet lab. So we have 8 stations where we have residents, so we can have a whole resident class in there all together teaching at the same time. It has AV set up such that you can have a faculty member at the front teaching a skill, and then there's screens above each station so they can see what people are doing. They can even circle places, so they can show you this, place the suture here, or fix this, and they can communicate via the AV. So it's this sort of amazing wet lab. It has the simulators in it as well. During COVID, we were unfortunately unable to use it in the ways that we normally do. So one of the biggest sort of foundations of our surgical training in the wet lab is what we call our I&I sessions, so interaction and innovation sessions. And we have these once a month where we have faculty members who come in and they design curricula around things they think are important for residents to know before they come into the OR. So they're often complications in cataract surgery, or corneal suturing, or anterior vitrectomy, and sort of various different skills. And you'll get the faculty of retina, for example, will design a session. It's a 3-hour session. Residents rotate between different tasks. They have lectures. They're geared towards the level of resident, sort of whether you're a junior, intermediate, or senior resident. And they're these sort of hugely successful sessions that we initiated a couple years ago. During COVID, we couldn't do that. And so we tried to modify it, and we had a virtual surgical training program that we shared with the AUPO, and we had a bunch of programs nationally that were using it. And the idea being that when we couldn't spend time teaching the manual skills of surgery, that we could still focus on the cognitive skills in surgery. And learning surgery is twofold. You have to know both of those things. And so in those months when we were sort of stuck all at home and not in the wet lab, we had curricula that our residents went through over the course of a week that culminated in a lecture, and we actually sent some suturing materials home to different residents. They could practice at home and sort of continue to build in their surgical training that way, even when we weren't in the lab. Happy to announce we are now slowly and finally getting back in the lab. So we have started up our I&I sessions. They're all socially distanced and sort of in different places across the hospital now, but we're able to do them again. And then because of sort of some adjustments that we've had to make for COVID, this year we've actually built one-on-one wet lab sessions within each rotation that the residents go through.
Wow.
So they'll be with a faculty member on the service of the rotation that they're on. For example, they're on retina, and they'll go to the wet lab with one of the retina doctors and practice retina skills there. And that allows them to still have that time in the wet lab, but in a one-on-one and sort of safer way. Frankly, it's something that we probably should have done before. And so, there's so many bad things about that have happened because of COVID, but there's some good things that we're learning. And I'm thrilled that we now have all these one-on-one time that's built into the schedule. And I think that's something that we'll continue to do moving forward.
Absolutely. And I think that's one of the, like you mentioned, it's a kind of like silver lining. There's some things that will come out of this, tragic time, but there'll be things that maybe, revolutionize education. And I think this would be one of those things that would be very interesting. And maybe some other programs will start to implement that same technology or those ideas in their programs as well. So
yeah.
Dr. Lorch, now on the flip side of things, putting on the program director hat for yourself, what are some things that you would look for in applicants who make a good fit for the program? A lot of us are wondering about, as Mass Pioneer, just storied history in a program that's really steeped in a culture of a lot of innovation, like you mentioned. So what are the things of applicants who do a good job if they match at Mass Pioneer? What do you look for when you're looking through these hundreds of applications?
Yeah, it's hard. It's hard because everyone is so excellent. And, it's sort of the highlight of my year is reading applications because it's amazing and it's humbling. And I love learning about the things that people are doing, and it inspires me and makes me think about the things that we could be doing better here. I think the answer to that is twofold. So the biggest thing that I'm looking for are people who are going to be leaders in some way within our field. And so that is sort of intentionally broad, because we develop people who are leaders in so many different areas. I think an example now, our recent chief resident, who's now my telemedicine fellow, is on the board of the AMA and very interested in policy and advocacy. And I sort of imagine him doing that. And so that's someone who's sort of going to be a leader in that field. Similarly, we have people who go into education. We have people who are interested in clinical innovation. We've had residents who have had startup companies in tech that they have developed while they're in residency with us. I have residents now who are very interested in community health and sort of understanding healthcare disparities and working on that. And so, I don't care what kind of leader you're going to be per se, but I want to see that sort of drive and fire and sort of demonstration of leadership. And in part because I feel so strongly that Mass Eye Near has so much to offer. We have so many resources. We have such a breadth of clinicians, a breadth of leaders. We have access to all of Harvard and all of MIT. And there's just so much that we can offer to people that I want to get those people here so we can sort of promote them and support them in being successful in those careers. So that's what I'm looking for. I think in terms of the people who are successful, and so the people who I think enjoy the residency the most are people who sort of first and foremost are team players. So we have a big residency program with 8 residents, and it works the best, and it usually does work when they all sort of work together and are collegial and support each other, and frankly everyone usually ends up being the best of friends. But I think coming in with that attitude and thinking of yourself as not sort of an independent ophthalmologist with only your own goal towards leadership, but also being part of a team and part of a community will make you enjoy your residency more. And those are the kind of people also we're looking for, people that we want to be colleagues with and want to spend time around. I think also a sense of sort of independence and someone who's going to take advantage of different opportunities. And I talked to you about all the different hospitals that we go to and all the different situations that people are in. So I think sort of being able to sort of roll with the punches, be resilient, and to sort of soak all of that in and absorb it all while you're here. Sort of take advantage of it means you'll get the most out of your time.
Awesome. Yeah, I think those are a lot of sentiments that, I think many program directors care about, people who are leaders, but also team players, and then also can adapt and adjust when it's necessary. So I can tell you from—
We're all the same. I agree with all of the other program directors then.
Oh.
That's what we want.
Sure. And I think that's, there's a lot of applicants who I've personally gotten to know through this avenue. And I can tell you there's a lot of great people who will, I'm sure, be great candidates for the program. And, I'm as some of my new friends and people who I haven't met yet, I think that there will be hopefully people who can solve new issues and new problems that will arise down the road. So Dr. Lorch, I want to thank you so much for joining me, for talking with me, sharing, this information about your program with the rest of the applicants this cycle. And we look forward to switching seats with you eventually and answering questions. I'm sure a lot of people out there are looking forward to it.
Looking forward to it too. Like I said, it's a strange season, but we're all in it together. And we're sort of, I think as program directors, we're aware of that and willing to help in any way we can. So please feel free to reach out as you did. Thank you for reaching out to me. I've had fun.
Thank you so much. All righty. Bye-bye.
Bye.